video, I'm going to explain what treatment for PTSD involves. So basically, there are two treatments that have been shown to be effective for PTSD. The first one is cognitive behavioural therapy, or CBT, and the second one is EMDR, or eye movement desensitization reprocessing. So in this video, I'm going to explain about CBT, and in the next video, I'll explain about EMDR. Okay, so CBT for PTSD, or trauma-focused CBT, usually involves about 6 stages. So I'm going to talk you through those now. The first stage is an assessment stage, where your therapist will ask you the details of your trauma. And it's really important here to stress that you won't be asked to share any information that you're not comfortable sharing. Your therapist will ask you a little bit about the impact that the trauma has had on you, on your relationships, your other responsibilities and commitments, and more general questions about your life, your background, and your goals for therapy, so they can get a complete picture about what's going on for you. Then they'll use this information in the second stage of therapy to develop a plan, and they'll share this with you. So basically what they believe will help you best, will meet your specific needs, so that you know what to expect and can feel really comfortable in the process, because it can feel a little bit daunting. Okay, in the third phase, you're going to learn a little bit about how your mind deals with trauma. So why sometimes memories are stored in, I guess, not the normal way. So in a way where they continue to intrude on your awareness, almost as if the event is still happening. Now, the idea here is that if you can understand a little bit more about how your mind works, it puts you in a much stronger position to tackle your symptoms. Okay, in the fourth phase of this treatment, your therapist will help you to identify those thoughts and behaviours that are exacerbating the anxiety and depression that surrounds your trauma and is preventing the healing process. And they will help you to create alternatives that will lower your anxiety, that will lift your mood and will kickstart that healing process. Okay, the fifth stage of this treatment is something called reliving. So this is where your therapist will help you to reprocess what has happened to you. So to sort and refile those memories and pack them away so they behave more like normal memories. So you have more control over them. So no more flashbacks, no more images, no more nightmares intruding on your day-to-day. Now, this is a challenging part of the treatment. So you will be fully prepared and supported throughout it. And you won't start it until both you and your therapist are really confident that you're ready for it. Okay. The final phase of therapy, or stage of therapy, is where you identify those factors that have made you vulnerable to developing PTSD in the first place, to kind of future-proof your treatment, to make sure that this doesn't happen to you again. Okay, now as I said, in the next video, I'm going to be talking you through what EMDR involves. But in the meantime, thank you for watching. I hope this was helpful, and I'll see you soon.